Hello, ladies and gentlemen. This is Dr. Debtanu Banerjee, MD, Internal Medicine, Consultant Physician, and today we are here to discuss about a very relevant topic in today's generation: metabolic syndrome, which encompasses the entities of diabetes, hypertension, dyslipidemia or hypercholesterolemia, and of course, obesity. So yes, as you understand that India is not only the diabetic capital of the world, but also a country where many people come to us with these problems on a daily basis. And they can be controlled not just by medications, but proper and healthy lifestyle and grooming as well. But the problem arises that the society still has a stigma to many of these diseases or ailments, should I call them so. Where is the basic problem? We don't understand that some of these diseases runs in our genes. Ask me, doctor, we are taking a very healthy diet, but why am I hypertensive? I don't eat much, why am I diabetic? It might just run in your genes. You need to understand that. And genes does not mean your father, maybe the entire Indian genome, right? Of course, the westernized lifestyle and a bit of pampering from our parents adds on to unhealthy lifestyle, eating habits, lack of exercise, sedentary lifestyle, which of course is a carryover burden. But apart from that, if we go into the basics of things, screening for metabolic syndrome becomes very essential at a very early age. So right since your adolescence, never take anything for granted. If you have blackish discoloration on the nape of your neck or your axilla, it might just be acanthosis nigricans, which is symbolic of insulin resistance, and it might be a precursor to the diabetes which might be following within the next decade. Of course, type 1 diabetes, which begins in the adolescence itself, may be a different ballgame altogether. But if we are talking pertinently about metabolic syndrome, then we are talking about insulin resistance and its entire fallout and side effects, which may also include facial hair, acne, and menstrual disturbances in the young females as well. So there, the gynecologists and their expertise comes into play. But from a physician's perspective, what is most important is how will you address these issues. Say a metformin or a GLP-1 analog is not the absolute treatment. You need to understand that even exercise mobilizes enough GLUT receptors in your adipose tissues and muscles to burn up the fat. So proper exercise, proper dietary restrictions, you have to forget about all these candies and chocolates and potatoes. Of course, glycemic control is there. You have to do calorie counting. If you take some sweet item or some calorie rich item in the morning, maybe you'll need to cut down on your carbohydrate somewhere down the day. A doctor and a diabetic educator will guide you regarding that. Whether you need insulin is something else. Again, that will be groomed by your physician and diabetes education team. Hypertension can simply be avoided by avoiding mental stress, taking good diet which does not include egg yolk, saturated fats. Of course, lean meat and chicken are always preferable than red meat and saturated fat items, as I've already told you. And extra salt in diet is always harmful. So a DASH diet, that is what we always say. Mediterranean diet, as many doctors would put it in that part of the world. Apart from that, obesity, you can simply measure your weight, but the problem is we have lean arms and legs, but centripetal obesity, fat in your tummy. So again, you need to know about your waist-hip ratio, your skin fold thickness, your BMI, and make sure you're not overweight. Hyperuricemia, some issues, yes, they come in for the heavy meat eaters, but that is again just a part and not a parcel, right, of the entire spectrum. Again, heavy body people may have obstructive sleep apnea. So again, that adds on to syndrome Z. That is an entire different story. We'll deal about it some other day. But the problem with diabetes, if you understand, is it has complications, microvascular and macrovascular complications. So microvascular complications will give you difficulty in vision long term, or in type 1 maybe even earlier. You will have difficulty in vision. You'll see that your retina is getting affected. You will have frothy urine. You'll see your kidneys are getting affected. You'll have problems in your nerves. You'll see you're having tingling, numbness, sore feet, and all the nerve problems will come in. Your neurologist will guide you there. And you have the macrovascular complications, the big complications. So, the name is funny. Microvascular, small problems. You can't see. You feel tingly beneath your feet. And macro, they have large complications. Heart attack, stroke, peripheral vascular disease, literally a nightmare. Lakhs of rupees go away just for putting in a stent and treatment of stroke and all that. Can all be prevented. How can it be prevented? If I go by the books, every 3 months, for practical purposes, at least twice yearly, screening in the form of renal function test, liver function test, HbA1c with fasting and PP of course, but HbA1c you can't cheat. So fasting PP you can cheat anyone, but HbA1c you can't cheat. And of course, whom will you cheat? You are the ultimate judge. You'll know for yourself. TSH if you're hypothyroid, because hypothyroidism is very commonly associated in this part of the world. Lipid profile to know about your good and bad lipids, their levels, whether you're being saturated. And one more thing I forgot to tell you, I think, is your diabetes also leads to MAFLD, so fatty liver disease. That is something else. So your liver function test also comes into the picture. And nephropathy, you can screen it with the urinary ME and quantify it using urine MACR. So all these investigations, if your physician tells them do it twice yearly, it's not drilling a hole into your pocket, but saving you from the bigger hole, which might just you might just end up with after getting admitted for the bigger complications, which I just said. So this was the session for today. I hope it was informative and you got some leaves out of it. And the next time we meet, and if you have questions, I'll be very happy to answer. And as you can already understand, it is a very important issue. Health is wealth. So instead of investing much on your gadgets, take care of your health, stay fit. We shall meet again. Bye-bye.